right. Good evening, folks. Thanks so much for being here tonight. My name is Edie Mars Power. This is the NAMI East Side Monthly Educational Evergreen Forums, or Evergreen Health Forum. We're sponsored by Evergreen Health to host this educational space every month. And I'm super excited to welcome some of our friends from the Emily program. They specialize in eating disorder treatment. And as this is National Eating Disorder Awareness Week, we thought this would be a really fitting topic to talk about, educate the community. So I'd like to welcome Lexus, Stacy, and Dee. Thank you so much for being here tonight, all of you. I really appreciate it. And we're excited to learn some more about eating disorders and eating disorder treatment tonight. So I'm going to pass over to my coworker Emma to ask you some questions, and then we'll open up for audience questions later. So thank you so much for being here.
Awesome. Thank you, Edie. So yeah, welcome everyone. My name's Emma Geary, use she, her pronouns, and I'm the community engagement specialist here at NAMI East Side, and I'm really grateful to be here and help kind of move this panel along in the forum and ask y'all some questions. So Stacy, Dee, and Lexus, again, thank you for being here. We'll start. Our first question for y'all is if all three of you, if you're comfortable, I'd love if you could take a moment to introduce yourself and share about your professional history in the field of eating disorders or what else you have worked on that's gotten you to this role here.
Lexus, you want to go first?
Sure. Hi, everyone. I'm Lexus Hartley. I use she, her pronouns. I'm the professional relations specialist here at the Emily program, which just is a fancy, confusing way of saying that I am a resource liaison and I help with all things community engagement. I think that's all I need to share.
How long have you been with the Emily program?
I have been with the Emily program since 2019.
Okay.
And where do you focus much of your outreach?
Great questions. My territory is Washington down through California, and that's a big mixture of working provider to provider and then doing community engaged research in schools, at community centers, and all things where you can make an impact to people. I'm going to do follow-up questions for you guys too.
You go right ahead.
Lexus is not highlighting how amazing she is. Dee, you want to go?
Sure. I'm Dee Myers. I'm the site director over at the Emily program in Spokane. And I have been treating eating disorders for about 27 years at this point. So I have specialized in eating disorder treatment since day one of my professional career, just about. I worked in adult psychiatric for the first 6 years. And then as soon as I went into private practice, I specialized in eating disorders. So I did 15 years of private practice in the Spokane community. I was really involved in a professional group here. We formed a coalition to bring eating disorder professionals together who were like myself, kind of practicing on their own. And through that coalition, I started inquiring for treatment centers to maybe come to Spokane because we had no higher levels of care here. And so I'm one of the folks who helped bring the Emily program to Spokane. And so I've been with us since we opened in 2013. I brought my private practice to Spokane Emily program, and I was outpatient therapist for just about a year and a half, and then I worked as the adult program coordinator in our adult program. So I moved to the higher levels of care in our PHP and IOP programs. And then I've been site director for the last 5.5 years. So working in this field, it's just what I do. And I really have a passion for providing education in the community as well. And we know how important it is, Stacy will vouch, how important it is that other professionals in the community, you don't have to specialize in eating disorders, but getting people to just know what they're looking for. And so whether it's to professional education or education to friends and family, it's really an important part of what we do.
Love that. I'm Stacy Schulter Paisano, she, her pronouns, and gosh, Dee's got me beat on time. She's been doing 27 years. I've been working actively in the field since 2007, so 18 years roughly. And prior to that, though, actually, before I even started working in the field as a clinician, I worked at what was previously Eating Disorders Awareness and Prevention, what is now National Eating Disorders Association. So I worked for them first as an intern during my undergrad, and then as an employee. And I worked on their 1-800 helpline. I worked on their website. It was a nonprofit, so I kind of did whatever, might be necessary. And it was really valuable experience. I had knowledge that I wanted to work with eating disorders in the future, and so that was really valuable. And then I pursued further schooling so that I could work with eating disorders in the way that I wanted to. I did a brief stint in substance use disorders, which was also a very steep learning curve, but really educational. And then, like Dee, I started my private practice, and I'm in South Sound, which is also known as Olympia, Washington. And that is where I started my private practice. In our community, there wasn't a lot of services available. So a small group of us got together, very similar to Dee's story, to provide services for people with eating disorders, their family members, and really just help those impacted by these very unique and complex conditions. And after I was in private practice for roughly 7 years, I had met folks that worked for the Emily program. We had opened a site in Seattle and then Spokane in 2013. And they approached me and said, would you have interest in this? And I said, oh my gosh, don't tease me. That is my dream. And so the South Sound location opened in 2014. And I've been with them ever since as their director, and we offer different levels of care at that location. Somewhere in the midst of all that, I did pursue my certified eating disorder specialist certification, just so that I did have a little additional education, and it felt like something that was necessary. I struggled with my own eating disorder back in college, and I think the certification as a specialist in eating disorders felt more important to me actually than my master's degree, because it felt like, okay, I've done this body of work, and now I, feel qualified to treat individuals following my own recovery process. So it's very exciting, and I love the work that we do, and I'm thrilled to be here. So thank you for having us. I think you'll find both Dee and I, and Lexus, if she talks more, are really passionate about what we do and increasing awareness, providing education, and helping individuals impacted by eating disorders.
Wonderful. Thank you, all three of you, for sharing about your experience so far. Moving on to our next question. I guess I'll direct it towards Dee first, and then we can pass the ball around. So what is the Emily program, and what treatment services are offered?
So the Emily program is a national eating disorder treatment company that we have facilities all across the nation. We treat higher levels of care of eating disorders that range from inpatient down to outpatient, which I'm sure we will talk about in more detail. And we treat many different diagnoses, many different populations, and we have been around for 32 years. Okay. I was going to say 30, but I thought, oh, I think it's been more than that.
I only know that because our founder, his anniversary was just on our anniversary page. And I was like, oh my goodness, Dirk has been here for 32 years, which is so cool.
Yeah. Stacy, you want to add to that? We
We
have lots to add, so.
Yeah, I know we could talk about the Emily program for, a very long time. So like Dee said, we do provide the continuum of care from inpatient down to outpatient. And in outpatient, we also have outpatient groups, which is terrific. And then we have specialty programs as well. So I think as an organization, what our founders' mission was to provide, services for folks with eating disorders and a higher level of care, as well as outpatient. Not all eating disorder facilities provide that whole continuum. Most do higher level of care or outpatient. So it's really neat that we're able to provide kind of all of it, right? So people can come in and it's kind of a one-stop shop that we're able to provide not only like comprehensive assessments, and just that provides information in and of itself, but then also folks can join our services and can get support at the level of need they have, which I think is a really special quality. And nowadays, post-COVID, we learned so much from that time, right? We have both in-person programs as well as virtual programs. So in each of the states in which we offer services, which include Washington, Ohio, Minnesota, North Carolina, Georgia, Pennsylvania. I think I might have gotten all Alexis. And in each of those locations, we do have in-person and virtual, which I think is really neat and allows for folks that wouldn't have previously been able to access care to get in to services and receive necessary support. So here in Washington, we've been able to reach people in really rural areas. I'm born and raised Washington, and I've learned about places in this state that I was never aware of that previously we wouldn't have been able to provide because they wouldn't have been within driving distance of a location. So the virtual services is a really neat addition that has become kind of a permanent fixture with us.
Yeah, and I can talk about the different levels of care that we have. So in Washington State, we have residential down to outpatient, but within our company, we do have a couple of locations that have inpatient care. So a lot of people use inpatient and residential interchangeably, but they're actually really not. So for us, inpatient care is more of an acute hospitalization for someone who needs medical stabilization. So even though someone might be really severe in their eating disorder, usually inpatient is only about a couple of weeks. So someone may go into the hospital for a week or two and get medically stable to go to residential. So in Washington, residential is our top level, but that's where someone has a bedroom there. It's 24/7. You're having your meal, all of your meals and snacks there. It's supported, and one of the main functions of residential treatment is that symptom interruption, because you are with support and staff 24/7. So if someone is having difficulty, say, they aren't able to stop their purging behaviors when they are in a facility where they're surrounded by support and peers and staff and locked bathrooms, then it helps them maybe to interrupt those behaviors. So residential is basically living there for however many months a person might need, weeks or months. And then they step down to partial hospitalization, which the state of Washington, what?
No hospitals involved.
Yeah, the state of Washington makes us call it partial hospitalization, but it's really intensive day treatment is a better term. And for the Emily program, we have 6 hours a day, 5 days a week. So some companies have longer PHPs and it may go into the weekend. Ours is Monday through Friday. And our individuals receive 2 meals and 1 snack with staff around and it's a multidisciplinary care approach, and they are attending groups and meals all day long in a supported way. So those individuals, when they start being able to use the skills and that they are learning in program and they're starting to have success outside of program, then we start thinking about stepping them down in a level of care. So from PHP, they may step down to IOP, which is 3 hours a day, 4 days a week. And that includes 1 meal and 2 groups. So if you're thinking about it in a step down approach, someone may be in 24/7 residential, step down to 30 hours, 5 days a week, step down to 12 hours, 4 days a week. and then eventually stepping down to outpatient care. So one of the things that we like to stress is really thinking about it like a ladder, because wherever a client may step into IOP and then go through IOP treatment, and then we step them down to outpatient care. And I will add a little anecdote here that I like to share, that as a private practice provider who provided outpatient care for years before the Emily program came to Spokane, my most severe clients I would send to residential. And so at that time, they would go to Arizona or California or Philadelphia. I had some clients go, and they would go to residential for 1 or 3 months, do a lot of treatment, restore weight, interrupt their symptoms, come back to Spokane where they were jumping down to outpatient care. And most of them would start relapsing almost immediately. And I always describe it like I felt like people were like slipping through my fingers. You know, I would try to see them a couple times a week, and we had the dietitian and the doctor, but you just, they would just relapse from that 24/7 down to outpatient. And I had a client that went to residential 3 times, and 2 times came back, relapsed. The third time, she was in California. She rented an apartment from the treatment center and did PHP. And then she stayed and did IOP. And then she came back to me, an outpatient, and she didn't relapse. And that's when I was like, whoa, what is this PHP thing? We need one in Spokane. And so that was part of my passion in bringing one to Spokane, was that experience. And so we really see the benefits for clients as they do the graduated step downs in the support and structure.
And one thing I'll add, that was very well described, Dee. One thing that I'll add for folks that aren't aware, Dee mentioned there being 2 meals and a snack or a meal. So during treatment, whether it be residential, PHP, or IOP, those eating experiences are what we call therapeutic supported meals. And they're a time when both a therapist and a dietitian are sitting with or on screen with a therapist and dietitian are on screen or sitting with clients. And so if clients are experiencing any challenges with the meal, whether it be, difficulties with taking another bite, or difficulties with, portion, or difficulties with texture, or difficulties with whatever it might be, the therapist is available for any kind of skills coaching that might be helpful, or to facilitate other clients, kind of encouraging that client along, or there being some shared learning. And the dietitians are there to ensure that adequacy is being achieved, they're meeting their dietary needs, and to do any fact checking that sometimes comes up, because there are some distorted beliefs around food for people living with eating disorders.
Thank you, Stacy and Dee. I really appreciate your knowledge on this area and sharing about the Emily program. I'll move on to the third question I have for y'all, which is a little bit broader. How do you see eating disorder treatment intersect with the other areas of mental and physical health?
Stacy, you can start on this one.
I'll start on this one. And the dogs, both of whom you've probably seen on the screen, are wrestling over there. So if you hear any noises, I do apologize. Or I'll give them a treat and that will make them stop. So one thing that we like to educate about and make sure people are aware is roughly 70% or upwards of 70% of people living with mental health conditions, other way around, people living with eating disorders also have a co-occurring mental health condition. So that is something that any of us working in the field have to be really aware of, is just this reality that individuals, may be living with a depressive disorder, an anxiety disorder, PTSD, ADHD, one of the autism spectrum disorders, along those lines, we have to be skilled in kind of recognizing both what might be co-occurring and then how to help with the treatment of that. And in some cases, the mental health condition may actually be something that exacerbates the eating disorder, meaning the eating disorder behaviors may be used to kind of cope with those internal experiences that go along with. So if somebody's dealing with generalized anxiety disorder, for example, and they have kind of dabbled in relationship with food or in food related behaviors, and they find, oh, these food related behaviors, whatever they may be, distract me from the anxiety, or they numb the anxiety, or they just kind of quiet the anxiety. And that can, move into an increase in behaviors and an increase in acuity. Same with any of the other conditions. So we could go into more detail about all of that. But I think there is a significant, I know there is a significant intersection that we all have to be aware of. And I think another thing to highlight about that intersection is just the reality that, like mental health conditions, eating disorders, I mean, they are a mental health condition, but eating disorders are biological brain-based conditions that also have genetic influences and are kind of interacting with the sociocultural experience and the environmental experience that people are having. And so there is this element of treating the symptoms that we're encountering and intervening on those symptoms, while also looking at kind of the underlying psychological framework and the context in which the eating disorder developed or is maintained, because we do have to oftentimes address both. When we have folks with obsessive compulsive disorder, for example, that also have an eating disorder, oftentimes the two interplay in a way that we need to be able to respond to effectively and help coach through and help clients, identify skills that are effective and also kind of titrate the exposure that we're doing, because that's how we work with OCD. But when it comes to food, it's a both and, because obviously we know people need to nourish their bodies. And when the OCD is interfering with that in some way, we need to be able to navigate that effectively and skillfully. Dee, what would you add?
That was really well said, Stacy. I would just add that, when I give talks, I say that most of our clients have a comorbid psychiatric diagnosis. They of usually anxiety and or depression, but also OCD, autism spectrum disorders, ADHD. So Stacy's right. It's just so common that you have to look at the intersection of both of those things. And then I also was thinking about the incidence of trauma, and we know with mental health in general that people with mental health diagnoses have a higher percentage of incidence of trauma in their lives over the general population, and eating disorders is right in there. So a lot of our individuals have experienced some sort of trauma as well. And then with those biological brain-based conditions, it's very complicated, and you can't really just treat one and not the other. So at the Emily program, we do treat individuals with an eating disorder primary diagnosis. So, sometimes if someone comes to treatment with us and their depression is so severe that they really aren't able to participate in the eating disorder treatment, then we might pause their eating disorder treatment and have them get their depression treated and more under control. But sometimes it's a delicate balance of when you start to arrest the eating disorder symptoms and behaviors, then sometimes the mental health issues start to pop up more, because as Stacy said, people are using their eating disorder as a way of managing that. So we have a saying that we use in treatment that is, eat all the meals, feel all the feels. And so as somebody is eating the meals and is more better nourished, then sometimes we start to see those feelings and the emotional issues. And sometimes those mental health diagnoses become more clear as someone gets nutritionally rehabilitated.
I love that phrase.
eat all meals.
Go ahead, Stacy. Did you want to add something?
Yeah, I was just gonna say not to bring in another, and it's necessary because mental health conditions, right? So substance use disorders are something else that we do encounter, and a couple of different things. So I mentioned when I was introducing myself that I worked in the substance use field for a period of time, and it was a really steep learning curve, but also really valuable. I knew I wanted to work with eating disorders, and it was actually really fascinating to see individuals that were striving toward recovery begin to kind of dabble in eating disorder behaviors or start to do different disordered things. And we can talk about the difference between disordered eating and eating disorders, but do disordered things, whether that be somebody that's striving to recover from stimulant use, for example, and now their body's changing and they don't desire that. And so now they're striving to manipulate their food intake to control body shape and size. And so we encounter that obviously on the eating disorder world side of things, as well as other substances that folks use to avoid those emotions. You know, when Dee says feel all the feels, that is, you know, many of our clients' kind of worst nightmare. Feels are really uncomfortable and they're not fun to experience. And so there is a lot of effort that might go into avoiding them. And so whether it be disordered eating behaviors or, you know, substance use or self-injurious behaviors, you know, we encounter a lot of these maladaptive, I'm going to put that in quotes, you know, because it is something that people come by naturally, but that really aren't sustainable or damaging to them overall. And so there is this kind of very complex interplay of things that we get to address in treatment. And like Dee said, also, we do have to kind of prioritize or evaluate what's primary in this situation. You know, so if, you know, they're dealing with an eating disorder and substance use is actually primary, we may first refer them to substance use treatment. Or if they're dealing with an eating disorder and their PTSD is so present that, you know, they're not equipped to kind of manage the different things that are showing up, as we're kind of focusing on the food piece of things, we may encourage, you know, some specific PTSD treatment first. But conversely, we may say, no, you need to focus on the eating disorder first, because once you open up that door to whatever trauma you've encountered, the eating disorder is likely going to get much, much worse because it's a coping method, right? That's one thing that I like to really help people understand or think about, is that eating disorders are, for the individual struggling, are a method of coping with different things that are showing up. There was a quote that I came across, Virginia Satir, a long time ago, a therapist said, you know, the problem's not the problem, coping is the problem. And I love that for, you know, substance use, eating disorders, self-injurious behaviors, whatever the behavior is. It's like, what if we just focus on coping? I'm about to, I think, get on the soapbox, so I'm going to just come back and say, okay. Anything to add now that you've heard that, Dave? That's what we do. We just play off each other.
Yeah.
I love it. It's wonderful.
Yeah, I think we just can't underscore enough the intersection. Actually, when I saw that question, it was like, yeah, no wonder NAMI is having us, because there is such an intersection that's really important.
Yeah. Wow, you perfectly segued into my next question, Dee, which is how can organizations like NAMI, other mental health advocacy programs and organizations better serve those affected by eating disorders and their loved ones who may be supporting them?
I think one of the first things that we would say is to help people get education, whether, you know, your consumers get some basic education about eating disorders and the interplay between eating disorders and mental health. We really advocate for screening. So, you know, NAMI, even NAMI volunteers, you know, just if you have the basic education about eating disorders, then you can hear things that may make you say, "Ooh, hey, I'm going to ask a couple of questions about this to someone." And so knowing how prevalent eating disorders are with individuals with anxiety and depression and PTSD and OCD and all of that, that, asking a couple of questions can really help to identify that this person may have an issue with food, weight, shape, body that needs to be addressed.
I would add to that, I think awareness raising efforts, the value of them cannot be stressed enough. I think part of what Dee just said is the prevalence. I don't think people that don't do what Dee and I do recognize the prevalence of eating disorders. So what we know, and I think we might have written it in the write-up for this opportunity actually, was that every day somebody dies in the United States every 52 minutes, right? So that's, 24 people a day, right? If I'm doing my math correctly, and that's really concerning. Or the statistic that eating disorders are more common than breast cancer. I think about the number of people in my life that have had breast cancer, and then I kind of have to reflect, wow, do more people in my life have eating disorders? Am I even aware of that? I think it's necessary to know because there's so many, particularly in this diet culture that we live in, right? A culture in which, higher weight bodies are vilified and lower weight bodies are glorified. And there's this constant pressure to mold and sculpt and shape our bodies that when folks, do move into kind of diet land and they are engaging in a pattern of dieting, 1 in 4 people who diet will go on to develop a pathological relationship with food, which can sometimes include clinical eating disorders. And I think we have a tendency to minimize behaviors, whether it be skipping meals, over exercising, binge eating. I think we have this tendency to minimize those things, like, oh, everybody does that, right? Instead of recognizing, like, actually, that's a life-threatening and quality of life interfering condition that person is living with, and it needs intervention, but at the least it needs some education and some awareness raising efforts. So I think awareness, which is, I don't pretend to know all the things that NAMI does. And I think awareness raising efforts is definitely one of those things. And so I think having that knowledge that eating disorders are far more prevalent than maybe people realize, that folks with mental health conditions may be struggling in their relationship with food, that help is available, and that recovery is possible. Those 3 things are just critical. And so I think NAMI could, support the entire population by raising awareness, sharing resources, which I think is your next question, if I was privy to the questions. And Dee's going to share some of those. So sharing resources and knowing that specialized help is available, which a lot of people are reticent to pursue, like, oh, it's not that bad. I'm not sick enough, whatever it might be. And knowing that eating disorders really steal one's life, right? Like I mentioned earlier, I dealt with an eating disorder, and when I look back on that time, I feel like I was sitting on the sidelines of life. I was not a participant. I was, so preoccupied with all the things and engaged in all the behaviors, and it it stole so much from me. And when we help folks get to a place of fully participating in life and freedom from the disordered eating, but also oftentimes from diet culture, there's so much freedom that they gain and so much life that they can reclaim. So awareness, resources, and knowing help is available, I think, can be really critical. I told you I get really excited about this topic. Go ahead, Dee.
Yeah, just to sort of piggyback on a couple things that you said, it made me think about one, that just like with other mental health diagnoses, information is power. Information is so important. And I know in our field, Stacy and I have been in it quite a long time, and we've seen a lot of growth in our field. And it's really, really rewarding for clients to come in now that we know so much about the brain science behind eating disorders and the interplay between so many different things, the genetics, the environment, the experience that someone has that leads to an eating disorder, that information and that knowledge lets people know this isn't my fault, and there's treatment available. There are research-based treatments, evidence-based treatments that we know help for people to recover. And there's newer diagnoses. ARFID, avoidant restrictive food intake disorder, is very, very common in our programs. And when we first opened in 2013, we had our first ARFID client a year later, and now we have ARFID clients in every program at all times. And those individuals, it's been really neat to see where they go, oh my gosh, I'm not just a picky eater. And a lot of people have traumas from earlier in their life when, their parents were trying to get them to eat different things. And so I just wanted to highlight that knowledge is power, and it really is, it empowers our clients to get the help that they need and to know that it's not their fault.
Mm-hmm.
And the other thing, which is trying to slip my mind, but I'm trying to hold on to it. Dang it, I think it left. It'll come back in a minute.
Please do share when it comes back. Go ahead, Stacy.
Piggyback for 1 second if possible, because Dee mentioned avoidant restrictive food intake disorder, which is, a very unique presentation that does really require some specialized treatment. And my piggybacking is going to be about a different diagnosis that has people oftentimes being like, no, it's not a problem, or this isn't an eating disorder, and that is binge eating disorder, which many people don't know is 3 times more prevalent than anorexia nervosa and bulimia nervosa combined. So these like very well known eating disorders, and then we have this one that is so prevalent. But I think again, people tend to minimize, or people think they need to just get over it or have more willpower or find the next right diet of the 33,000 diets out there. And we've developed a specialty program for binge eating disorder that's available virtually in all of our states, because the treatment is a little bit more unique than our mixed diagnosis milieus. And so we have the opportunity to really address the layers of complexity that oftentimes are present for individuals living with a pattern of binge eating. So I think that's maybe something that we didn't mention when we talked about what the Emily program is and does, is we really do try and focus in on, these basically services that wouldn't otherwise be available. So avoidant restrictive food intake disorder being one of those, binge eating disorder being one of those, because, I think in eating disorder treatment, which has come so far in the last 2 decades, does have a tendency to focus on anorexia and bulimia. And, we know that there's a wide spectrum of diagnoses that we really want to be able to meet people where they're at.
And you helped me remember the other point that I was thinking that could be helpful with NAMI in that awareness is that weight does not equal health. Size is not determinant of health. And that is something that is so important to recognize. So the health at every size movement, and recognizing that, we can definitely attest that we have seen through the years so many individuals who are normal weighted or low weighted, who are very unhealthy physically and emotionally and mentally. and there are individuals in larger bodies as well. But the size is not a determinant of health, and that is what is something that we fight back in society so much, because diet culture is alive and well, and it isn't going anywhere, which is really unfortunate, but true.
Yeah, I think another statistic that I find to be just whoa, is that 6% or less, so equal to or less than 6% of people struggling with eating disorders are underweight. So, but right, like when we think about that stereotypical eating disorder, right? It is an underweight human, like an emaciated human even. And the reality is it's actually less than 6%. So if 94% of people dealing with eating disorders are straight size or higher weighted, that is something that we really need to keep in mind, because I think people do have this kind of assumption that we'll know if somebody has an eating disorder just by looking at them. And that is so false. And so that's something we really need to emphasize and remember as well.
And also assuming so many things about individuals who live in larger bodies.
Yeah.
And about their health, about their eating habits, that is often so untrue.
Which is probably a good time to say, another thing that Emily program does focus on is weight inclusive treatment. So not really aligning with the weight normative approaches that do rely maybe on BMI to, determine whether or not a person is healthy, or to determine whether or not a person, what they need to do with their weight, but instead allowing for all bodies to be what they're genetically gifted to be, and knowing that any person can achieve health, regardless of what body size is. So I think that is also very important, because sadly I've read a lot or heard about, facilities that folks go to that in which they experience weight stigma, or they experience weight bias, or they experience just different treatment as a result of being in a straight size or higher weight body. And that's just not right, because the reality is eating disorders impact, so many, if not every body system. And regardless of what the body shape and size is, that needs to be attended to. So just another soapbox we could get on. And Emma, go ahead with your next question.
I love it. Be on your soapbox. That's what we're here to give you the platform for. But I have one last question before we'll open it up to audience or additional things we want to add, which is, what resources should family members and loved ones, friends, community of those with eating disorders be tuned into? What resources should we be looking into, knowledgeable of, like you said, to spread the information so that we can see what's happening with our loved one?
Yeah, so I have a few resources to suggest, and one of the first ones is that deals a lot for families that have children that have an eating disorder, but I think the resources expand outside of just if your children are young and at home. But it's called Feast, and now, Stacy, I wrote it on that paper. Families, I'm trying to remember now what it stands for.
Families empowered and supporting treatment.
Okay. So Feast is an amazing website that has tons of webinars. Thank you, Lexus. Tons of webinars that you can watch, different materials. They do a 30-day for families, where every day for 30 days they email resources. So Feast is a really great family resource. And then I like to point people to the National Alliance for Eating Disorders website. They have a ton of support groups that are targeted for lots of different populations. So there might just be pro-recovery support groups, but there are support groups for BIPOC or LGBTQ. And we know that LGBTQ individuals are 70% more likely to have an eating disorder or disordered eating than the average population. So they also have, so there's a lot of different options there, and I think that they have some for family members as well. And then Project Heal is another national website that has a lot of specific different types of support groups like LGBTQ, larger bodies, BIPOC, male identifying, adolescent, Spanish speaking. Like Stacy mentioned earlier, one of the benefits of COVID is I feel like the virtual resource library expanded exponentially. And so this is an avenue. Project Heal also does a free supported meal for individuals who say maybe they have stepped out of like higher levels of care with us, and but they still want to check in once in a while and have a supported meal. So they have that through Project Heal as well. And then our own Emily program website has resources as well. We have lots of blogs and different videos that someone can access. And every month we do an ED 101 virtual in this for the state of Washington. I think they do it throughout the company, but I know for Washington we do a monthly Eating Disorders 101, and that could be for someone who thinks, I think I have an eating disorder, or I know I have an eating disorder, but I haven't started inching towards treatment yet. That could be a starting place. And I believe it's appropriate for families as well. And then there's also a friends and family group that happens each month. So that's more of a support group without the clients there, but for the community of support members. So those are some resources that I would throw out there. Stacy, do you want to add anything?
Yes. My doggies have the zoomies. I'm
Of course they do right now.
Of course they do. It's treat time, which means I'm reinforcing their zoomies. Um, so I would add National Eating Disorders Association, which is a organization that really their mission is to raise awareness, support friends and family members, and their website's organized in a nice way that information is pretty readily available. So that's a nice place to kind of swing by. When Dee was talking about what the Emily program offers, we also have a podcast,
Oh, yeah.
Yeah, it's called Piecemeal, and that can be looked up on wherever people access their podcasts. And it's really good because it has a wide array of different topics. And so you can look back at, the history and hear stories from people that are in recovery themselves and how they navigated that process, or more informational sessions that are done. So that too is a really good resource. I, like Dee said, I think there has just been kind of an explosion in information. And so I think for folks to be able to access resources such as these that have reliable information and information that can be counted on as a source of truth can be really valuable. I think for individuals struggling, and really their family members or loved ones, there can be a felt sense of aloneness, or I'm trying to navigate this by myself, and to encounter groups or more materials that help folks understand they're not alone, I think can go a really long way and can help people feel more open maybe to seeking the support that they need. Because many people, maybe with their behavior pattern, they experience a sense of shame. They feel like I should just be able to stop this, and then to be able to talk to other folks that are like, oh my gosh, no, I deal with the same thing. Or actually, it's a biological brain-based mental health condition, and let's practice some self-compassion around that. It can go a really long way. So I think all of the resources that Dee shared along with National Eating Disorders Association can be really helpful. And thank you for sharing all of those in the chat, Alexis.
I want
Yes,
to
and oh, go ahead, Dee.
I just wanted to say that this is it's not a treatment resource, but it's a resource for treatment. The Washington FMLA program, because we are in Washington, we really encourage clients and families to look into FMLA if possible. And it really helps to lighten the burden of someone who is in treatment, or if you need to care for your child while they are in treatment or go to appointments. You know, people don't know they can use FMLA on an intermittent basis and just different things. So I just like to throw that out there because it is something that is available to a lot of people in Washington State and can really help with those those aspects of treatment. And then the Emily program also has a foundation, that a nonprofit arm called With All, and our clients are able to apply for a grant toward treatment resources, treatment expenses. So not treatment itself, but say paying your rent or your electric bill or your cell phone bill while you're in treatment. So that's another resource that's available for Emily program clients too.
These are wonderful resources. Yeah, go ahead, Stacy.
It's funny. Now I'm having what Dee experienced. I'm like, there was something I was going to add in there. Maybe it will come back to me. But one thing I was actually going to also add was a caution. As folks are looking for resources, I know it can be tempting for support people maybe to provide a book or a resource, like, oh, it seems like you might be struggling with this. You might find this to be helpful. I will caution individuals struggling as well as support people that the memoirs are oftentimes not helpful. They're usually a guide to inadvertently, they're a guide to get worse. That's not the author's intention, but in the author's sharing of what they did in the midst of their eating disorder, it can wind up being kind of like what the person struggling experiences is like, oh, I should do that, or oh, I should try that. Like they actually look sometimes at those memoirs for inspiration or resources. I remember when I was in kind of the early days of the eating disorder I dealt with, and somebody gave me a book, and I'm not going to say the title of it, but it was a memoir, and it was very activating and only fueled the mindset and the behaviors. So just be cautious about any memoirs. Go with trusted resources.
That's an excellent caution, Stacy. Thank you for sharing that, adding that on. Well, and I wanted to say that all of these resources will be sent in a follow-up email to all registrants of the forum. So don't worry if you're rushing down to try to write down those URLs, we'll get those to you. But I'd love to take the last couple of minutes of our forum to open it up to any audience members. Either you're welcome to unmute and ask a question to our panelists, or if you'd like to write it in the chat, I can read that out for you. And I'll give a moment of pause to see if there's anything that populates for folks. Yeah, go ahead.
I am a parent in the school district, like Washington School District, and I have a friend, my best friend of 28 years, has a child with an eating disorder, and so very interested in this. But do you have anything you want to add that's very specific to teens and tweens?
Well, I'm really glad that I gave you the Feast website, because that is going to be an excellent resource. I will add, because I have an adolescent program at my site. Stacy has one at her site. The getting support for the parent and supporting the parent and supporting their child is really, really important. And that's a big part of what we do. And the eating disorder field has come a really long way in involving parents and support folks to as part of the treatment team. And so I would really encourage your friend to be sure that they are accessing some of these parent resources and support groups for parents because it is very difficult to have a child with an eating disorder. You're muted, Stacy. You're still muted.
Depending on the type of eating disorder the child is dealing with, if it is a restrictive eating disorder, I do highly recommend Brave Girl Eating for parents of teens that are living with a restrictive eating disorder. It is a good memoir, but it's very helpful. And I agree with Dee that I think getting support for the parents. Also, I don't think if kiddo will do it, I don't think it hurts to do an assessment just to get a little bit more information. They don't have to pursue the recommendations unless they feel motivated to do so. But in doing that, and the Emily program does comprehensive eating disorder assessments, at the end of which, here's some education. Here's what I would diagnose you with if relevant. Here's what I would recommend at this time. And then the caregiver and with maybe some influence from the teen can decide at that point, do I want to follow those recommendations? Do I want to pursue alternative resources? But at least it is just a little bit more information. And one thing we haven't mentioned on screen tonight, this isn't necessarily relevant to your friend, but it's important to point out, the Emily program does, particularly in Washington, does accept state insurance, which is awesome because it just opens up the door to more people that previously weren't able to access it. We started accepting state insurance in 2020. So I totally love Dee's feast recommendation because I think that has a ton of great resources, and ideally your friend, obviously you're a source of support, but also is able to identify some source of support that help them feel less alone, but also, that have some wisdom and guidance, because parenting a young person or, a human in general with an eating disorder is, it's such a helpless feeling. Yeah.
Yeah, thanks for coming, Aspen, to learn more and help support your friend.
And ask the question too.
Yeah.
I lost service for a bit, so I might have missed this, but there's also a flyer for Feast in there that goes more in depth on the majority of resources they have because they've definitely expanded in the last several years. But part of their biggest community is their Facebook forum, which helps connect individuals to be able to have a live space to ask questions. It is monitored by individuals that Feast trains themselves and make sure that they are adequate in providing good services and good recommendations for people, but that can be a great space for you as a caregiver to mom who's supporting an adolescent with an eating disorder, as well as mom to gain more resources.
That's amazing.
That is super cool. And one thing I'll add, I think treatment can be really intimidating to families and young people. So for young people, there's also a form of treatment called family-based treatment, which is FBT. It's an evidence-based treatment for eating disorders that doesn't involve higher levels of care. It does put a lot of ownership on the caregivers, but the caregivers get a lot of coaching throughout the process. So the caregivers kind of wind up being the ones that hold kiddo accountable to resisting urges, to not engaging in behaviors, to eating adequately, but they're receiving coaching along the way. So that can sometimes feel more approachable to some families. It's not the right fit for every family, but for some families, it can feel more approachable.
Thank you for the info.
Yeah, absolutely.
Lexus is a wealth of information. It amazes me what you can add.
I was lucky enough to just have Judy Krasna with me in Seattle to do a full deep dive into everything Feast. So
Oh,
this flyer that I put in is directly from Judy at
So
Feast,
great.
and there's a lot of like hyperlinks to be able to get access right into them from the sheet.
oh, that's
So
amazing.
great.
That's very, very cool. Y'all have shared so much great information with us tonight. I have been also everything you've dropped in the chat, everything I have written down everything and downloaded any of the files. So all this will go out to everyone who registered for the event tonight. And honestly, I think that we'll put a lot of it up on our website resources page as well. This has been so helpful, I'm sure, not only to Aspen who joined us tonight, but also to us, me and Emma and NAMI too, just to kind of like get more of a feel for like what we can offer to people when people call asking us questions. So thank you so much to all of you for joining us tonight. I really, really appreciate it. Do you have any final thoughts you want to add as we kind of wrap up for the night?
I'm super appreciative of you hosting this, for your continued effort to educate the community and parents and providers and all of the humans, because you might not always see the impact, but I know it's having one. So thank you for what you're doing.
Yes, and thank you for the opportunity. This is, Eating Disorder Awareness Week, and allowing us to be a part of this from the Emily program. And Stacy and I love doing this kind of thing. So it was a really fun way to give back during Eating Disorder Awareness Week. So thank you.
Yeah, thank you. Thank you for being here. Stacy, D, Lexus, thank you so much for your partnership and yeah, I'm super excited about all so you guys shared so much tonight. So I think it'll be so super helpful to a lot of people. Recording of this will also be going up on our website afterwards so people can access later. But otherwise, this has been the monthly educational forum, NAMI East Side's monthly educational forum sponsored by EvergreenHealth. You can keep an eye out for what next month's topic will be. It is the last Tuesday, or not the fourth Tuesday of every month. The fourth Tuesday. Some months have 5 Tuesdays, so I always have to clarify that. The fourth
Yes.
Tuesday of every month. So be on the lookout for what next month's topic and guests will be. But with that, I will go ahead and wrap things up for the night. And everyone, thanks so much and have a lovely evening.
Thank
Thank
you.
you.
You do the same.
Yes.
Bye.